It is a peculiarity of New England, the two-year term for governor. Only New Hampshire and Vermont make their chief executives answer to voters so frequently, and it means that just as a governor is settling into the job, they've got to think about re-election. Doing that thinking is the man joining us this morning, Governor Chris Sununu. Thanks for being here.
Hey, thank you, Adam. Anytime.
We appreciate it. Before we get to that 2018 stuff, a more pressing matter. We see in our power centers in this country, Washington, New York, Los Angeles, this confrontation of some very ugly behavior by some men. How do you read this, I guess, this moment that we're going through right now in terms of workplace and the treatment of women?
Well, I can look. It's a transformative time, and hopefully for the better, for the positive. A time when women can stand up, feel free to speak out on issues of harassment, whether it's in a corporate workplace or in a political atmosphere, in Hollywood, high-powered executives. It seems like there's always a new story every day. Every story is shocking. So at the end of the day, what we have to do in New Hampshire, or I mean with me, with myself, it's about zero tolerance, right? Make sure we have a firm zero tolerance policy each and every time. You know, when it comes to the State House, I can't control the policies of every branch of government, but what we can do is lead by example and hopefully empower women to be able to feel comfortable standing up, speaking out for themselves, speaking out for others, and making sure that in this transformative time we are doing it for the better. And this is a change that takes our entire country in a more positive direction.
You mentioned the policies there at the State House. I believe John DeStaso has reported that 280 of the 400 or so reps signed a sexual harassment policy. That means about a quarter of them didn't. Some of them say they didn't receive it, but others say on principle they wouldn't do this. Is that troubling to you at all that they wouldn't endorse these just very basic minimums?
Look, I haven't seen the policy itself. It's part of the House of Representatives. You know, I don't have oversight on that. I don't know why you wouldn't necessarily sign it. But look, if anything, signing a piece of paper like that, it can, even if it's just symbolic, saying, yeah, we understand what's going on out there. We understand that there may have been some issues in the past, and we're willing to kind of move forward, be transparent about what's going on, and hopefully create a better culture, a better atmosphere. And there's nothing political about that. Republican, Democrat, Independent. You have to move forward and create a culture where people feel comfortable coming forward, people feel comfortable standing up for themselves, and individuals know that that type of behavior is simply not going to be tolerated.
There's a parallel discussion going on right now in the Alabama Senate race. The candidate there, Republican Roy Moore, facing some very serious allegations dating back to the 70s and 80s. Do you support him as a member of the Republican Party or someone who should be in the U.S. Senate?
No, not at all. Absolutely not. There's no place for that. I mean, what started out as allegations turned into some pretty clear evidence. So I know I've said from the beginning he should definitely be stepping down. I think anybody with those types of issues should be stepping aside and focusing on, frankly, on themselves, on how they can be, frankly, a better person. There's a lot of personal reflection, I think, that has to go on, and some personal growth that has to go on with individuals like that. So I absolutely don't support Roy Moore. I don't support Al Franken. I don't support any of these folks across the line, that whether it be in the political sphere or, like we said, the corporate world or entertainment, whatever it might be. These are very, very serious issues, and this can be a very positive, transformative time for our country as a whole. We got to go through the bumps of it, but hopefully, and as we are seeing more women step up and step out and say, yes, you know, this was real, this happened, and they're being supported. I think traditionally in the past, it goes without saying, there are women that have stepped out before and not been supported by other women in sometimes. So that type of atmosphere, there's no place for that. So you got to be supportive of it. You got to be open and create a culture that demands that type of change.
All right, hopefully we do see some progress out of this. Let's shift to some policy. Education Freedom Savings Accounts, that just got a positive vote out of committee in the House. Is this program basically an acknowledgement that there are some public schools that aren't doing their job and should have students leave, essentially?
I don't know if it's an acknowledgement that public schools are failing or anything like that. I think it's an acknowledgement that we're finally at a point in New Hampshire, especially in New Hampshire, where we're focusing on the individual. We're saying an individual child's path might be different than the traditional model. That's okay, and we're going to provide supports for that individual. Maybe it's through these education savings accounts, so a student can go to a different school or have tutoring. The flexibility that this program offers is huge. And when you look at individuals, especially on the lower income scale, you know, families that simply can't afford other alternatives, now we're opening the door. Right? I say it all the time, but it really is fundamental. The government cannot guarantee much, but what it should be focusing on is guaranteeing opportunity. Equal opportunity. It's why we fought so hard to get full-day kindergarten. We fought so hard for the Governor's Scholarship Program, and we're going to fight hard for this because it's about equal opportunity and providing individuals a better path that fits their needs, not just that fits the system.
Is the state going to be able to track whether or not kids are getting an adequate education if they leave the public system? Because critics say there's not enough oversight in this bill.
Well, the amendment that was recently put forward puts in some of those metrics. How are we going to track it? How are they going to be tested? And so yeah, absolutely. I'm an engineer. I'm all about the numbers and the data. So you have to have accountability within that system, and that's what this most recent amendment actually did.
Let's shift to the opioid crisis. On your most recent trip to Washington, you met with the drug czar, and you actually sat down with him and provided him kind of with a laundry list of some ideas, some innovations, some concepts that you'd like to try here in New Hampshire. And there was a price tag on that. What was that price tag, and how did you get to it?
Well, it was a lot. Look, it's a great opportunity anytime you get to go down to Washington and sit with some of these administrators, especially the interim drug czar. And he said it was the first time a governor had come basically with a laundry list, if you will, of what we needed to do, whether there were wraparound services on the Safe Stations program, which has been successful, transitional housing programs, expanding Granite Hammer and Granite Shield, our recovery-friendly workplace program, which is really the first of its kind in the country, prevention programs in the state from first all the way to 12th grade. The numbers in the realm of well over $300 million, $350 million, something like that we asked for. Now, will we get the full 350? No, probably not. But as governor, I'm going to advocate. I'm going to be at the table. I'm going to ask for everything I can possibly find under the sun, and then we can negotiate back. Where the administration finally goes with the dollars, we're not exactly sure. But one of our strongest points has been they have to focus the money where the issues are. So whether it's New Hampshire and Massachusetts, Ohio, some of these key areas that are dealing with opioids, we're kind of on the front lines of it. That's where the money needs to go. The Cures Act, you know, that was a fine piece of legislation, but it sent money to places that really didn't have an opioid crisis like we do. And I think there were a lot of dollars wasted there. We can invest our dollars in a much more impactful way. We can get a better bang for our buck, so to say. We can get the data back, see what's working. We can really be that laboratory, that innovation machine for where we go with the opioid crisis and be a national leader. And so that's what we're advocating for. You gotta be there at the front lines and at the front of the table with this administration, and that's what we're doing.
How did you get to that $350 million number? Because I know on our end, we've been asking HHS for a long time, say if you had to design a perfect system to tackle the opioid crisis, how much would it cost? And they won't tell us.
Well, the way we got to it is we sat down with all the stakeholders, right? We sat down with folks from New Futures. We sat down with folks in transitional housing, folks from the Safe Stations program, folks that are helping us build our recovery-friendly workplaces, folks from the school system on prevention programs, workplace prevention. So we just brought all of them in and figured out what we wanted to focus on, where we were today, where we saw some of the gaps, and then we just kept kind of adding up the dollars. It's a lot of money, to be sure. You know, can we build a center of excellence so we are actually getting better at training nurses and clinicians and folks that are working in this realm to be a center of excellence where we can get the best out of our workforce. It's a workforce driver as well. So there's a lot of stuff in that pie, so to say. But I got to tell you, the administration was very receptive. I think they loved the idea that we were coming forth with real ideas, like someone not just advocating at 30,000 feet with nice headlines, but really getting into the details, because that's what we do here in New Hampshire. We can get into the details. We can understand the dynamics. There's no politics in any of this. Republican, Democrat, Independent. I think we all agree we've had some success here, but there's a lot more we can do.
You mentioned the recovery-friendly workplace. How do you get buy-in from employers who will be assuming some risk here to take on those people who are in recovery, and that job is a big piece of staying sober? Sure.
So the recovery-friendly workplace program was an idea that we kind of shepherded a little bit back in my previous job at running Waterville Valley, and I just want to expand it a little bit. And what it is really empowering employers with the tools and resources to understand what it means to be in recovery, what it means when somebody has an addiction problem. It doesn't help anybody, especially in our current working climate, when somebody comes and says, I'm having a problem with opioids, for that employer to say, well, you're fired, you got to move out. It's not good for the employer, not good for the individual. You don't just want to send the employee back to the wolves, so to say, with no hope. So it can be a 1 + 1 = 3 type solution within the workplace, and empowering employers to take some responsibility, a proactive approach that can help themselves as well as the individual. It's been a home run. So we released the program maybe about a month ago. We brought employers in from all across the states, and people were signing up literally on the spot. It was really great because I think people understand the crisis that we have in the workforce, the crisis we're having with opioids, and when you can put the two together, real solutions can come.
Medicaid expansion is going to be a big piece of this puzzle. The commission that was tasked with looking at that just came forward with a new idea, well, an idea to shift it all into a Medicaid managed care model. Do you support that? Is that what we're going to see in 2018?
I do. I mean, I've looked at it very carefully. Moving into a managed care model for the expanded population, could save the state, upwards of $100 million, which is huge, without cutting services and cutting quality of service to anyone. So it's just better management. And that's what, look, one of my foremost roles as governor is to be a manager. It isn't just about cutting dollars here and adding dollars there. It's about finding the better pathway for the populations that we're talking about. So in the case of the expanded population, moving them into a managed care model could save us a lot of money. I'm also continually advocating with the federal administration to get more flexibility, right? To be able to let New Hampshire design a system that meets our needs, our constituents' needs, whether it's elderly or the opioid crisis, more transitional housing, job training programs. All of this wraps around into getting better total quality of care for those within the Medicaid and expanded Medicaid population. If we can get some of those flexibilities, it could be a huge win for New Hampshire.